Inside the womb, you'd think it's the safest place in the universe. But sometimes an invisible battle can break out. And it's not against some outside threat. It's a conflict against the mother's own body. This is an amazing story of a medical mystery, some mind-blowing breakthroughs, and the fight to save the tiniest patients imaginable. I mean, just think about that for a second. It's a terrifying thought, right? The very immune system that's designed to protect a mother can, in some cases, mistake her own developing baby for an intruder and go on the attack. The medical name for this is hemolytic disease of the fetus and newborn, or HDFN for short. And what it means is that the mom's body starts making these antibodies that cross the placenta and just start destroying the baby's red blood cells. This can cause all sorts of serious problems like severe anemia, heart failure, and a really dangerous condition called Hydrops Fetalis. So, what on earth triggers this kind of internal war? Well, it all boils down to something you've probably heard of, a simple mismatch in blood type between the mom and the baby. Think of it like a security system that gets a false positive. If a mother has Rh-negative blood but her baby is Rh-positive, her body can come into contact with the baby's blood cells. Her immune system takes one look, doesn't recognize them, and flags them as a threat. So it starts building up an army of antibodies to destroy them. It's a process called alloimmunization. And believe me, this wasn't some super rare thing. If you look at the data from the 1950s, this condition, which they called Rh isoimmunization back then, was happening in about 6.7 out of every 1,000 births. Before we figured this all out, it was a common and, honestly, a pretty tragic part of pregnancy for a lot of families. But then, everything changed. A total medical revolution happened. Scientists figured out a way to basically stop the mother's immune system from ever even noticing the baby's blood cells were there in the first place. The answer was a simple injection called anti-D immune globulin. You might know it by the brand name Rogam. It works kind of like a stealthy cleanup crew. It has these pre-made antibodies that go in, find any of the baby's Rh-positive cells floating around in the mom's bloodstream, and get rid of them before her own immune system has a chance to sound the alarm. It's just a brilliant piece of preventative medicine. And the impact? Oh, it was staggering. As you can see, once this anti-D shot became routine for Rh-negative moms, the number of cases just plummeted. It was a total game changer. This one shot took HDFN from being a common fear to a condition that was almost entirely preventable. Okay, so prevention is awesome, but what happens when it's too late, or for some reason the mother is already sensitized? Well, this is where we get into the absolutely incredible world of fetal medicine, where doctors can now treat a patient who hasn't even been born yet. So first things first, how do they even know the baby is in trouble? Instead of risky invasive tests, doctors can now use this special ultrasound to measure the speed of blood flowing through a tiny little artery in the baby's brain. See, if the baby is anemic, their blood is thinner, so it flows faster. It's this high-tech, totally safe way to get a clear signal that the baby needs help, fast. And the help they provide, it's nothing short of a miracle. It's called an intrauterine transfusion. It's literally a blood transfusion for a baby still in the womb. Using an ultrasound to see what they're doing, doctors guide a tiny needle through the mother's belly, into the uterus, and right into a vein in the umbilical cord. They give the baby a little medicine to keep them still, and then they deliver life-saving O-negative blood, replacing all those red blood cells that were being destroyed. It's just, wow. But does this incredible procedure actually work? You bet it does. In one of the major studies on this, doctors treated 18 babies who had the absolute most severe form of HDFN. And out of those 18, an unbelievable 16 survived because of these in-womb transfusions. I mean, this is literally snatching life from the jaws of defeat. So, of course, this brings up the biggest question of all, right? After going through all of this drama before you're even born, what does the future look like for these kids? Are there any long-term effects? And here is the absolute best news of all. Researchers have followed these kids for years to answer that exact question. The conclusion, and you can see it right here in this quote from a big study, is just so reassuring. Kids who survive even the most severe cases of HDFN thanks to these transfusions have long-term developmental outcomes that are no different from their brothers or sisters who never had the condition. They do just fine. The story of HDFN is really a story of one breakthrough after another. We went from a common tragedy to being able to prevent it to being able to treat it in the womb. But medicine never stands still, so what's next? We'll say hello to nipocalimab. This is a brand new therapy that's being tested right now, and it works in a completely different way. Instead of cleaning up the baby's cells or replacing them after they're destroyed, nipocalimab tries to build a shield. It's designed to physically block the mom's harmful antibodies from ever crossing the placenta and getting to the baby in the first place.
And the early results look incredibly promising. In a recent trial for the highest risk cases, historically, only about 10% of those pregnancies would make it to 32 weeks without needing one of those in-womb transfusions. With nipocalimab, that number jumped all the way to 54%. That is a more than 5-fold increase in babies who were protected and didn't need that invasive surgery before birth.
When you step back and look at the whole arc of this story, it's just amazing. We went from a tragic fate to preventing it with a shot, to performing microsurgery on patients we can't even see. And it all leads to this one fascinating question for the future. As medicine keeps getting better and better, could these new therapies make even these incredible life-saving surgeries in the womb just a relic of medical history?